Welcome back to 10/11 News at noon. Monday marked the first day of the fall season. The CHI Health St. Elizabeth is focusing on fall prevention this month. It's one of the most common and serious injuries that sends people to the emergency department. So here with us today with some important reminders is trauma program educator Eric Jensen. Eric, thank you so much for being here.
Thanks for having us.
Yeah, so when we're talking about falls, what kind of incidents do you see at CHI St. Elizabeth and how common are they?
They're actually really common. One of the leading causes of injuries in patients over 65 years of age. We see in the last couple months we've probably averaged about 50 patients a month coming in with a fall injury of some sort or another, ground level falls, fall from heights. So.
Yeah, a lot of times I'm sure it's when you just catch your foot wrong just on those ledges, you know, and that can just, even a tiny misstep can cause big problems.
Yeah, absolutely.
Yeah. So when we're talking about these falls, what are some common risk factors like those ledges and things?
Yeah, well, of course there's always age, but then that comes with other things like your vision, environmental factors. Is a room poorly lit? Do you have a rug down?
Yeah.
So there's a lot of little things that can lead up to those tripping and fall hazards.
Okay. And then what are some easy ways that people can prevent falls? Some tips that can help folks out?
You know, you can have those bars in your bathroom. Those are really helpful. Keeping your areas free from clutter, the things off the floor, rugs are really a big tripping hazard. We love our little pets, but sometimes they can be in the way, so that can be something we have to be mindful of. Monitoring your medications. You get a new medication added that might interact with some of your other medications and may lead to some trouble with balance as we move forward. So.
Yeah, I've definitely tripped over a toddler once or twice.
Yeah,
so,
absolutely.
Yeah, little pets,
All
kind of
been
the
there.
same height. Yep. Or a lot of times I think of cords too in these day and ages. Everyone's charging a phone or a laptop.
They're everywhere.
Yeah,
so
cords.
keeping them out of the way and keeping those walkways free and clutter free are very important.
Yeah, absolutely. Exercise, also important piece of fall prevention. What can you recommend for folks there?
You know, just things you can help with your balance. There's different programs like Tai Chi is helpful. You can work with your primary care provider. Sometimes they can refer you on to physical therapy and they can work with you on balance related issues. Using your devices, you know, we don't always like to say we need a cane or a walker, but if that's helpful for getting around, use those. You certainly don't want to increase your risk for a fall.
Yeah, a lot better to use them than to spend time in the
Absolutely.
hospital. So, and I always think about the ice too with winter coming up as well.
That's going to be a big trouble, yeah. So proper shoes, another thing you can really do.
Yeah. All right. Well, Eric, thank you so much for being here. We
Thanks for
appreciate
having
it. Yeah. We'll be right back with a final check of Brad's forecast after the break.